Good afternoon. Welcome to our virtual class for Care of Mother and Child, Well Clients. So the focus of our discussion for this afternoon is for us to be able to understand nursing process, what are the steps in nursing process, and how it is utilized in the care of mother and child. So we define nursing process as the core of patient care delivery. So in the nursing process continuum, nurses are constantly faced with data and information. So I utilized yung PowerPoint ko that I used for nursing informatics as well, because this contains the information about nursing process. So data and information are integrated in each step of the nursing process. So what are the steps in nursing process? We have assessment, diagnosis, planning, implementation, and evaluation. So these steps in nursing process, meron siyang, there are changes as we continue to modify the nursing process. So before, so part of the history natin yan. So the classic nursing process, so since the 1970s, the nursing process has been the label applied to an underlying scheme that provides order and direction to nursing care. Nursing process serves as a tool used by practicing nurses to make decisions and to predict and evaluate the results of nursing actions. Students of nursing use the nursing process as they learn to behave as professional nurses in practice behave. So ano ito? How important is this nursing process? Diba, if it is a process, we follow a step-by-step procedure, so that when we go through the process, we will not be left confused on what is the next step to do or to follow. That is why this nursing process was developed and utilized by nurses, especially in the clinical practice. Okay, this is how important yung nursing process is. Ito yung core concept ng ating nursing profession. Utilizing the different steps in nursing process in the care of our patient. Another definition of nursing process is that it is a systematic, organized method of planning and providing quality and individualized nursing care. So remember, quality and individualized. So we are not making or formulating a plan of care for the whole patients in the unit. If, for example, we have 15 patients under our care in the unit, hindi lahat ng patient na yon will have the same plan of care. Remember, individualized. So it depends on the patient that we are taking care of. Okay, so ano yung needs ng patient? Kanya-kanyang needs, individual needs. So we have to formulate plan of care according to the need of the patient. That is why it is individualized nursing care. One intervention is applicable to this patient, patient A, but may not be applicable to patient B, or even though they have the same diagnosis or disease condition. Kasi iba-iba yung perception natin in terms of how we perceive illness and how we react to interventions. That is why it has to be individualized. Okay, it is synonymous with problem-solving approach that directs the nurse and the client to determine the need for nursing care, to plan and implement the care, and evaluate the result. So again, all of the steps in nursing process work hand in hand. If you have your interventions and towards the end, after rendering your intervention, you found out that yung intervention mo is not helping your client. So that is upon making your evaluation, then you can reassess your plan of care and then reformulate or restructure another plan of care that will be effective and applicable for your patient. Okay, another definition of nursing process is it is a gauche approach. When we say gauche approach, it is goal-oriented, systematic, and humanistic care for efficient and effective provision of nursing care. Again, goal-oriented. So we have to set our goal when we formulate the plan of care. One example of goal, ito basic lang na goal natin. If your patient has fever, ang goal natin is to lower down the temperature. Pero we have to be realistic in the formulation of our goal. Kung ang temperature ng patient natin ay 40, kaya ba natin tong pababain in a span of 15 minutes to 36 or 37? Is that realistic? So let us see ngayon kung ano yung disease condition that caused the increase in temperature of our patient. If it is bacterial or viral in nature, it is impossible for us to lower the temperature that much. From 40 to 36 or even 37. Masyado yan. And this will cause problem to our patient. Ito ngayon yung sinasabi nating goal-oriented. At least from 40, malower down natin siya gradually into 39 after 15 minutes, and then 38 after 15 minutes of intervention, and then hanggang sa mag-normalize yung kanyang temperature. So this is what we meant by goal-oriented, systematic, and humanistic care. And that is also part of nursing process. Okay, another definition, the common thread uniting different types of nurses who work in varied areas is the nursing process, the essential core of practice for the registered nurse to deliver holistic, patient-focused care. So this is according to, or the definition given by American Nurses Association. Okay, when we say holistic care, we are not just referring to the physical signs and symptoms presented by our patient when they come to seek consultation or they come to the clinic or hospital to seek consultation. When we say holistic, we have to consider the totality of the person, the whole body of the person. When we say whole body, it includes psychological, emotional, cultural, religious aspects, and other factors that contribute to the development of the illness. So yan yung when we talk about holistic care. Okay, so hindi lang yung pag sinabi ng patient mo na meron siyang, the patient verbalizes pain, ang focus natin sa pain lang. No, it's not that way. We also have to take a deeper look on what caused this pain and what contributes or aggravates the pain felt by our patient. So that is holistic approach in or patient-focused care. The term nursing process was first used or mentioned by Lydia Hall in 1955. So Lydia Hall is one of the theorists in nursing. So siya yung nag-propose ng nursing process wherein she introduced 3 steps. So ito yung history of nursing process. So 3 steps, and what are these 3 steps? We have observation, administration of care, and validation. So yung mga terms that was used by Lydia Hall in her theory about nursing process, ito rin is integrated in the modern nursing process that we are using. So please remember these 3 words: observation, administration of care, and validation. Meron lang change sa words that was we used in the modern steps in nursing process, pero it will all boil down into these 3 concepts or 3 steps. Okay, so after the 3 steps proposed by Lydia Hall, it daw, ang improvement niya or change into 4-step process. And this is known as the API. So we have assessment, planning, implementation, evaluation. So going back to the theory of Lydia Hall, observation refers to assessment. Okay, so kasama yan. So observation is assessment. That is what we do on the first step of nursing process. We observe and we assess our patient. Now, yung planning here is yung ating goal. Di ba? Yung ma-remember ninyo earlier, yung goal-oriented. So this is now yung planning or setting our goals for our patient. And then implementation is administration of care. So implementation is also the same as interventions. So this is now administration of care. And the last, which is evaluation, is validation. So we are now going to evaluate if yung ating intervention is effective and applicable for our patient. So that is validation of the care rendered to our patient, whether it is applicable or effective. If not, then we can restructure our nursing process or plan of care. Okay? Now, nag-evolve ulit siya into 5 steps. This is now what we know as ADPI. So we have assessment. Assessment is observation. Now we have the diagnosis. So we formulate an assumption of what is wrong or what is the disease condition of our patient. So this is now diagnosis. And in diagnosis, we make use of the nursing diagnosis. So again, we will learn this different nursing diagnosis as we continue with our discussion of the nursing process. So meron tayong mga suggested standard nursing terminologies. And one of which, yung most commonly used natin when it comes to nursing diagnosis ay NANDA. So, maririnig nyo to frequently if we are discussing nursing process, yung NANDA, North American Nursing Diagnosis Association. Okay, so nandun lahat ng recommended nursing diagnosis that we can use based on the problem presented by our patient. So, suggested nursing diagnosis yan. Kasi when we do the diagnosis, hindi tayo parang doctors na nagda-diagnose. Like for example, yung patient natin nag-present ng productive cough, tapos meron siyang fever, meron siyang colds. Ang diagnosis probably ng doctor dito is pneumonia. But we cannot use pneumonia as our nursing diagnosis. So in lieu of the pneumonia, titingnan natin kung ano yung problem ng ating patient. So kung ano yung associated with pneumonia or productive cough, pwedeng difficulty of breathing. So yan ngayon ang ating nursing diagnosis. So pwedeng merong difficulty in expectorating mucus. So that is another example of nursing diagnosis based on the problem presented by our patient or the signs and symptoms that we have observed during the assessment step of nursing process. Now, planning is our goal. So ano yung, what do we intend to reach at the end of our interventions? Okay, and then we have implementation. So this is interventions or yung ating administration of care. Okay, and then we have the last part is evaluation. So this is for ADPI. Again, from the 3 steps according to Lydia Hall. And then it became 4 and then 5. And meron ulit tayong additional. So we know this as ADOPI. Okay, so we have the assessment. So assessment is our observation. In assessment pala, we have cues. So yung cues na to, it could be subjective or objective. So when we say subjective, these are verbalizations by the patient. So example, masakit ang aking tiyan. So that is verbalization, that is subjective cue. Now, ano yung objective cue? So when the patient verbalizes pain in the abdomen, you will be able to observe that the patient is holding the painful area. So the patient might be holding or guarding yung abdomen because it is painful. So that is part of objective cue. What can we see or observe on our patient that has something to do with the verbalization? So the patient verbalizes pain on the abdomen. So we can observe that the patient is holding or guarding the abdomen because it is painful. We can also observe yung facial expression ng ating patient, which is frowning, and that signifies that something is wrong with the patient. So ito yung objective cues na tinatawag natin. So those cues that we can see or observe from our patient. So wag ma-confuse ha. When we say subjective, these are verbalization from our patient. And when we say objective, these are cues that we can see or observe. So that is part of our assessment. Two categories, we have the subjective and the objective cues. And then we also have this diagnosis again. Yung diagnosis natin is based on the nursing diagnosis. So we can make use of the NANDA. Okay. And then we have now the outcome identification. So aside from a goal for our patient, we also have this outcome identification, and this is also one of the standard nursing terminologies. So meron na tayong NANDA, may mga suggestions on what diagnosis are we going to use. Meron ding mga suggestions on what outcome do we want our patient to have. Like for example, kung ang patient ay going back to our example na complaining of pain, so our outcome identification is that at the end of our intervention, the patient will now verbalize relief of pain. So that is outcome identification. And that will also be part of our planning. So sa plan natin, our goal is that the patient will be relieved from any pain that is felt at the time of our assessment. So sa planning, ang planning natin ay it should be SMART. I am not sure if I have the SMART definition here, pero please take note of this. When we say SMART, it has to be specific. S is for specific. M is measurable. A is attainable. R, realistic, and T is time framed or time bounded. So magbigay tayo ng example for planning. So going back to temperature. Okay, sige, yung ano na lang, yung pain na lang na felt by our patient para meron tayong basis. So sa planning natin, when we say SMART or specific, we have to be specific on what do we want to achieve at the end of our intervention. So like for example, yung pain natin, pwede nating i-categorize kasi ito. So based on the verbalization of our patient, the patient can identify whether this pain is moderate or severe. So pwede nating lagyan ito ng numerical coefficient or equivalent. 0 being no pain, 5 being moderate, and 10 being the highest or severe pain. So if like for example, yung patient ninyo mentioned that pain is at the rate of 8 or yung scale of 8. So nasa severe type of pain yan. So when we say specific, at the end of our interventions, the patient will verbalize relief of pain from 8 to at least 5. So from severe, naging moderate. So that is being specific. Can we measure? Yes. Based on the details given by our patient. Again, yung expressions, yung verbalization ng patient natin, kapag pain, when we talk about pain, is valid. Kasi siya yung nakakaramdam. Diba? So pag initially, ang sabi niya is 8, and then ang goal natin is to at least minimize yung pain from 8 to 5, and we will ask the patient kung ano na yung level of pain. So that is measurable. Is that attainable? It depends on the interventions that we are going to do to our patient. So, kung yung mga interventions natin is really to address pain, then yung from 8 to 5 is attainable. Are we being realistic? Yes. Pero from 8 to 0, that is not realistic. Okay, from 8 to 5, yes, that is very much realistic. Time-bounded or time frame. So at the end of, like for example, 30 minutes of rendering nursing interventions, the pain level of our patient will now be from 8 to 5. So yung time frame mo doon in doing your intervention is within 30 minutes. So that's how we do planning. So we follow the SMART approach in planning. Again, S stands for specific, M, measurable, A is attainable, R, realistic, and T is time-bounded. Okay, now we go to implementation. When we choose implementation for our patient, we have to take a look at the cause of the problem para we will be addressing yung cause ng problem, and then later on, mas magiging effective yung ating interventions. Okay, so i-address natin yung cause ng problem. Diba? Para mas effective. And then towards the end, yung evaluation ninyo is based on the interventions that you render to your patient. And pag yung patient natin, so going back to the example of pain, if your patient verbalizes that pain is reduced from 8 to 6, at least you are on your near your goal of 5. So kung hanggang 6 lang yung naabot or na-reach ng inyong intervention, then you can continue with your intervention up to the time that you have reached your goal. So instead of doing your intervention for 30 minutes, you can add another 30 minutes to continue with your interventions. Diba? So yan yung 6 steps in nursing process. Meron pa bang addition to 6 steps? Let us see. So the nursing process is goal-oriented method of caring that provides a framework to nursing care. It involves 7 major steps. So nagkaroon na ng addition na letter R. Okay, so what is this adopire? Okay, so assess. So we have the assessment. What data is collected? Again, we have the subjective and objective cues. Diagnose what is the problem. Before I forgot, yung diagnosis pala natin, we also follow PES format. So when we say PES, P stands for problem, E is etiology or the cause of the problem, and S is symptomatology or signs and symptoms. Again, when we formulate our nursing diagnosis, we follow the PES format. P is for problem, E is etiology, so what is the cause of the problem, and S is signs and symptoms. Okay, so and then we have outcome identification. This was originally a part of the planning phase but has recently been added as a new step in the complete process. And then we have the planning, how to manage the problem. And then we have implementation or putting plan into action. So we have this how, and then we have to put the plan in action. That is implement or implementation. And then the added R here is rational. So what is the scientific reason of the implementations? Okay, so example, yung one way of relieving pain in your implementation is to distract yung attention of the patient towards the pain by visualization, guided imagery, yung bibigyan mo siya ng time to divert the attention from the pain by pwedeng reading magazines or watching TV or listening to music, Ito yung mga diversionary activities. Ano yung scientific rationale for this? These interventions diverts the attention of the patient from the pain felt into other activity. So, nababawasan, naiiba yung kanyang focus. So, the patient will no longer focus his or her attention to the pain, but instead, meron tayong other activities. So, it depends on the situation or the cause of the pain or the problem. And then we have the evaluation. Did the plan work? So, yun sa evaluation natin kanina from scale of 8, naging 6. So, at least nag-work yung ating intervention. But this time, since ang goal natin is to lower down to 5, then we have to continue with our interventions. So, ito yung how the nursing process evolved through time. From the time of Lydia Hall na 3 steps lang up to the 7 steps that we are using right now. So we have the ADO PIRE because of the inclusion of the rationale or the scientific reason of the implementation. So this is all about nursing process, and again, this is the core of nursing practice. So we have to utilize the nursing process in the care of mother, child, adolescent, client.